Hello everybody, and welcome to the Alzheimer's Society of Simcoe County's Facebook Live Q&A at noon. My name is Erica, and I'm an education coordinator here at the Alzheimer's Society. So if you are joining us today, if you want to let me know where you're joining from, maybe drop a comment down there or hit an emoji so I know that you're there. Today I will be talking about dementia-friendly communities. Our last Facebook Live session, which was on January 11th, I talked about this being Alzheimer Awareness Month. And I talked a little bit about stigma and people living with dementia who encounter stigma in our communities. And so the Alzheimer's Society is really focusing on creating dementia-friendly communities. And so that's what I want to be talking about with you today. So if you're watching and you're putting some comments or putting some questions down there in the comment box, just be aware that it takes a little bit of time for it to come over onto my end for me to see it, but I will do my best to answer your questions as we go along. So at any point when I see your questions, I will do my best to answer them for you. But of course, we always repost these videos, and you can contact us at any time with any questions you have about any of our Facebook Live broadcasts. So when you're thinking about this idea of dementia-friendly communities and just what is dementia-friendly communities? Well, we talk about a dementia-friendly community as being a place where people living with dementia, where they're understood, respected, and supported. And we may think, well, that's just obvious. Everybody should be understood, respected, and supported. But the lived experience of so many people living with dementia, as I mentioned in the last Facebook broadcast that we did, is that they don't always feel this way when they're out in the community. And of course, when we're thinking about somebody living with dementia, a dementia like Alzheimer's disease or vascular dementia or one of the many other neurodegenerative diseases, they are progressive in nature. And so people start to experience changes in the early stage, and they progressively get worse over time. But of course, there's a lot of living to do throughout the course of the disease. And we want people to feel comfortable going out into their community, doing the things that they enjoy doing, connecting with the people in the groups and the organizations that they want to connect with, and really feel that they are supported and they are included. So when you think about the Alzheimer's Society of Simcoe County and our vision statement is that people living with dementia, whether it be Alzheimer's disease or a related dementia, and their care partners, so that's their family and friends who are supporting them, that they are able to live well and thrive in their communities. And that's really the whole crux of dementia-friendly communities, is how do we create these supportive, inclusive communities where people living with dementia and their partners in care can feel like they are able to live well and thrive. And so there's many things that we can do to help create these dementia-friendly communities. And as I go along, I would love to hear your examples if you have any ideas of things that you can see happening in your community. If you want to share them with us, or if you have ideas of how to create more dementia-friendly communities, we would love to hear them. But some examples that we see happening in Dementia-Friendly Communities Initiative, and this really connects specifically to my role as the education coordinator, is to have some dementia training for businesses, community organizations. Often I will go into local churches and talk to the congregation. So really it's creating awareness about what dementia is and how it can impact the person living with dementia, and giving people some concrete strategies, things that they can do to create an environment that is inclusive and it is supportive. And a big part of that is just changing people's awareness and changing people's biases, like dispelling the stigma, as I mentioned in our last Facebook Live broadcast, is that if we can work at reducing that stigma, it will create communities, organizations, safe spaces for people living with dementia to be, where they will feel that they are included and supported and respected. So we do also do training for local businesses. So maybe it's like, for example, how many of us, we have to go out and do our shopping. Seems to be the only thing we can do these days, and go out to the grocery stores. So one thing that we saw happening at the start of the pandemic, and many stores are still doing this, is they created a space of time that lots of them are calling senior shopping hours. So there's kind of a minimum age limit. You have to be 60 or older or whatever their limit is to shop during those hours, but many of them are also saying older adults, but also at-risk people, because we do know that when we're talking about dementia, there are a lot of people living with dementia who are younger than 60, who have that young onset Alzheimer's disease or other type of dementia. So it's making sure that they can also be included in those times. And that means that they can go shopping at a time when there's less people, which means that there's less busy people who are getting impatient with them. They can take more time to really figure out where they need to go or what they need to buy, more time at the cash register. So it just creates that safe space for them. Doing some training for staff, for example, staff at the cash register, to give them some understanding of some of the changes people might be experiencing and how they can engage with those individuals to make them feel supported. For example, instead of saying, well, getting impatient when somebody might be struggling to use their cards, their debit card or credit card, or trying to figure out the right amount of cash to pay for their bill. Instead, stepping in and providing some assistance and support in that friendly, open manner, instead of expressing any kind of frustration at the customer, which you hope wouldn't happen anyways. But for people living with dementia, they have encountered that when they go out and shop, and then that leaves that negative feeling, like I don't want to go back out there and do these things because it doesn't make me feel good. So if we can just have that positive attitude when we're interacting with people, it can make a huge difference. So when we're thinking about just for ourselves, if we're out shopping or out doing our business and we encounter somebody who we can see is struggling a little bit, is also really finding the patience and having that awareness. Instead of feeling impatient because the person in front of you is taking too long to count out the cash, being willing to step back and saying, I'm in no hurries, and maybe can I help you in some way? And just offer that assistance. But a big part of it is just having the patience and being aware of our nonverbal communication that we're giving off. If we seem impatient or frustrated or angry, that's what somebody's going to pick up on. So really paying attention to how we're engaging, then having a lot of patience. Sometimes it is just offering assistance. You might see somebody who's out just on the sidewalk looking a little confused and not sure where they're going, and a big cue might be if they're not properly dressed for the weather. So maybe they're out on a day like today when it's quite cold out, but they're wearing a light jacket and light shoes. That might be a big indicator that somebody might need some of that assistance, and just going up gently and offering that help and saying, can I help you out, help you get where you're going, or get you to a warm place to warm up, or whatever. So it's really just helping each other and being good neighbors. As I mentioned in the last Facebook Live broadcast, there's been certainly some people living with dementia that have called out specifically the thought around Alzheimer's jokes, and that we as a society still seem to feel that it's okay to make light and make jokes of Alzheimer's disease or make those memory jokes. And that's a really easy way of just, not creating more dementia-friendly spaces, is just being aware of what we're saying. And the vocabulary that we're using. As I mentioned also in the last Facebook Live broadcast, just choosing the words that we use carefully. I just had a conversation with somebody recently who just talked about somebody suffering from dementia and talking about caretakers. Now, it just seems like normal language for people who are not aware of dementia, but for somebody living with dementia, have expressed that they don't want to be termed sufferers. That's why we use the term person living with dementia, and that's why we use the terms care partners, so that we're partners in care and not somebody. If the person is living with dementia, they're not the person receiving care or needing to be taken care of. So just watching those kinds of words can create those dementia-friendly spaces. And just some of the local programs that we see happening. So we do have some exciting things happening here locally in Simcoe County. One of them was a partnership that we had with the Quest Art Gallery in Midland. And this was just getting off the ground when the pandemic happened. And then unfortunately it had to take a hiatus, but I'm glad to say that we're starting to have talks about how we can get it happening virtually. but they're looking at dementia-friendly programming at the Quest Art School. So classes where the staff are educated on dementia, where it is a safe place for people to be, to engage with others. And we really like that because, at the Alzheimer's Society, we have a lot of programs for people living with dementia to come in and be part of things and engage with others. But it's so nice to see that happening in other community organizations outside of the Alzheimer's Society. We've also had local libraries. So the Aurelia Public Library had a monthly coffee social group that was happening for people living with dementia. So we're starting to see more community organizations creating these safe spaces. And a lot of them are happening in libraries, like I said, the Quest Art Gallery, and there's many more. And I apologize if I haven't mentioned an organization that's doing some dementia-friendly programming, but there's a lot of really great things happening. And it doesn't need the Alzheimer's Society to reach out and request organizations to do this. Certainly organizations can take this on their own and say, we want to create some dementia-friendly programming and connect with the Alzheimer's Society as a resource to do some training and awareness. But, we love to see organizations taking the lead on this. We also have seen with the Alzheimer's Society of Canada has done a lot of advocacy work with the Canadian government. And so I'm just going to read this statement to make sure I get it all right. But it is an exciting development in dementia-friendly communities. And it is that the Alzheimer's Society of Canada welcomes the $940,000 investment in the Dementia-Friendly Canada project under the Dementia Community Investment from the Government of Canada, administered by the Public Health Agency of Canada. So they are realizing just how important creating dementia-friendly communities are to people living with dementia, and that if people can feel respected and supported and included in their communities, they are going to be able to manage living with dementia for a longer period of time, which is going to improve their quality of life and for the quality of life of their family and friends. But also when you consider our healthcare system, it's going to allow them to continue living in the community where they want to be anyways for a longer period of time. So it really is a great public health initiative as well. So if you have any questions or ideas around dementia-friendly communities, certainly put them in the comments box. We'd love to hear from you. If you see some dementia-friendly community initiatives happening that you'd like to share, if you have any questions or have any great ideas, we'd love to hear them. So please continue the conversation. I'd like to end this Facebook Live just by giving you a little bit of a call to action. And for people living with dementia, we certainly have opportunities, volunteer opportunities. We do encourage people living with dementia to have their voice be heard if they're interested in advocacy work, to help to inform the work that we're doing on dementia-friendly communities, because they really are the experts on what it's like to live with dementia in their communities. So we love to have their participation. For the individual to just learn as much as you can about dementia and how you can be supportive. So what's inclusive, supportive language that you can use? What are some easy things that you can do in your own community to help make it more dementia-friendly? If you're involved in an organization and you're interested in doing some dementia-friendly programming, again, to reach out to the Alzheimer's Society, and we'd love to hear from you. We'd love to offer some assistance to help make your organization more dementia-friendly. So again, my name is Erica Rice, and I'm the Education Coordinator, and you can always reach me. You can call my direct phone line if you wish, and that is 705-329-0909, extension 3802. Or you can call our main phone line, which is 705-722-1066. Or you can give me an email at erice, E-R-I-C-E, at alzheimerssociety.ca, and I'd love to hear from you. So thanks very much for watching, and I hope you will join us for our next Facebook Live 2 Mondays from now. So we do it every second Monday at noon. Okay, have a great day.